In moments from now, we're going to be getting an update from President Biden on the COVID pandemic and the American response. The president expected to set a new goal of having 160 million Americans, that would be 70% of the adult population, fully vaccinated by the 4th of July. Here is the president.
Today, 2 months until July 4th, I'm here to report that we're in our vaccination program, where we are and what comes next in an effort to get this country back closer to normal. And first, where are we? Well, as everyone knows, I promised that we'd administer 100 million shots in my first 100 days. After we met that goal, we doubled it to a historic 200 million shots. By the time we reached the 100 days last week, we had shattered that mark with over 220 million shots in arms. And as we stand here today, almost 150 million Americans have gotten at least one shot. Over 105 million Americans are fully vaccinated. And among our most vulnerable populations, seniors, we're nearing 85% of those who've gotten their first shot. 70% of the seniors are now fully vaccinated. It's a dramatic turnaround from where we were in January, when less than 2% of adults and less than 1% of seniors were fully vaccinated. Not only that, cases are down in 40 states these past 2 weeks. Deaths are down dramatically since January, down over 80% among seniors, which includes a drop among Hispanics of 80% and among African Americans of 70% of seniors. There are tens of thousands of Americans alive today because who would not be alive otherwise were they not had access to rapid vaccination program. Moms and dads, sisters and brothers, grandparents, neighbors, old friends, they're around now, and thank God for that. Now, where do we go from here? Well, as we anticipated, the pace of vaccination is slowing. Now the majority of American adults have already gotten their first shot. But we're still vaccinating millions of Americans every day. In fact, in the last 10 days, 1 out of every 10 adult Americans got a shot. But soon we'll have reached the adults who are most eager to get vaccinated. And at that point, this effort will shift to a new phase, which is what I want to talk about today. Our new phase will focus on 3 areas. First, children between the ages of 12 and 15 years of age. They're not yet eligible for a vaccine. The FDA scientists are currently reviewing the data to decide if and when to authorize that age range for vaccinations. The FDA and the FDA alone will make that decision. But today, I want American parents to know that if that announcement comes, we are ready to move immediately move to make about 20,000 pharmacy sites across the country ready to vaccinate those adolescents as soon as the FDA grants its okay. Now, most Americans have a vaccination site about as close as their house is near to a neighborhood school. We're also going to slip vaccines directly to pediatricians, ship them to pediatricians during the following weeks, so parents and their children can talk to their family doctor about it and get the shot from a provider they trust the most. Easy, fast, and free. And if teens are on the move this summer, they can get their first shot in one place and a second shot elsewhere. We know that adolescents are at risk from COVID-19. Though serious illness at that age range is rare, they can still get sick and spread the virus to others. So my hope is that if the vaccine is authorized, parents will take advantage of it and get their kids vaccinated. The second area of focus is making it more convenient for everyone to get a vaccine. We know that many adults have not been vaccinated because they have found it too confusing or too difficult or too inconvenient to get a shot. So for those having trouble finding a location or making an appointment, we're going to make it easier than ever. We have formally launched a simple website where you can find the vaccination location closest to you. That site is vaccines.gov. Let me say it again, vaccines.gov. Go there now, find a location to get the shot, and make an appointment. Also today, if you prefer texting, we have another easy way to get the shot. Text your zip code to the following number, 438829. Your zip code to that number, 438829. And you'll get text back to the location that is nearest you with vaccines in stock right then and there. Yes, you can text your zip code right now to 438829 and get text back within minutes to places nearest to you to get a vaccination that are available immediately. So send this to your kids, your grandkids, your friends who have not been vaccinated yet. Now, I know some people find making an appointment in advance inconvenient. So starting this week, we're also going to direct all federal pharmacy partners to begin to provide walk-in hours. You'll soon be able to get vaccinated without an appointment at the vast majority of our 40,000 pharmacy locations across the country. We're also encouraging our state and local partners to have a walk-in ability as well to the sites that they run. And beginning next week, we'll be shipping new allocations of vaccine to rural health clinics, getting more vaccines to more rural clinics so Americans who don't live near one of the 75,000 vaccination sites will have new options that may be closer than anything they thought. We know that vaccination rates are lower in rural areas, and that's why we're going to get vaccines closer than ever to rural residents. Also, as we wind down the large mass vaccination sites, we'll move towards smaller locations, even more convenient to the unvaccinated. So, for those who don't want to drive the distance to a large vaccination site, we'll have sites, smaller sites, closer to the unvaccinated. And for the first 100 days, our goal will be to make it possible for people to come and get vaccinated, and will succeed beyond anyone's expectations, I believe. Now we're going to have to bring the vaccine to people who are less eager. So we also know that there are millions of Americans who just need a little bit of encouragement to get the shot. I recently called on employers to do their part by offering paid time off for employees to get vaccinated and opening up a tax credit program that reimburses the businesses for the cost of giving the employee the time off to get vaccinated. And I want to thank the 1,000 businesses that have stepped up so far. We're also going to roll out new partnerships with the business community. We're working with major businesses like grocery stores to provide special deals like discounts to shoppers who come to their stores to get vaccinated. And it works both ways. Bring them in to get vaccinated, but when they're in, they'll get discounts to purchase goods in that store. Further, we're working with major sports leagues to launch special promotions for their fans. Things like ticket giveaways, in-stadium vaccination programs, discounts on merchandise, and other creative ways to make it easier and more fun to get vaccinated. Now, I'm making it sound more fun to get vaccinated, but it doesn't hurt to get vaccinated. I'm not saying it's fun, but they'll be able to have other things available besides being protected from the virus. Let me repeat. We're going to make it easier than ever to get vaccinated. Visit vaccines.gov, vaccines.gov, or text your zip code to 438829, 438829. Walk into your local pharmacy without an appointment. Go to the doctor or local health clinic. It's free. It's nearby. Every adult is eligible. You know, go get the shot as soon as you can. The third area of our focus is Americans who still aren't sure they want to get vaccinated. We've seen the confidence in vaccines rise steadily these past few months among virtually every segment of the population. And as more and more Americans see their friends and family get vaccinated, they're making the choice to get vaccinated themselves. Democrats and Republicans, progressives, conservatives, people of all persuasions are getting vaccinated. In fact, the fact is that nearly 85% of seniors have had at least one vaccination shot, and the wide cross-section of the nation trusts the vaccine, regardless of race or ideology. Now, we need to make the same progress for those under 65 years of age. There are a lot of younger people, especially those in their 20s and 30s, who believe they don't need it. Well, I want to be absolutely clear. You do need to get vaccinated. Getting vaccinated not only protects you, it also reduces the risk that you give the virus to somebody else. It could save your life or the lives of people you love. We're still losing hundreds of Americans under 65 years of age every week, and many more are getting seriously ill from long stretches of the time. Look, even if your chance of getting seriously ill is low, why take the risk when you have a safe, free, and convenient way to prevent it? Additionally, we know that some people may need more information to decide whether to get the vaccine. There is now plenty of information for people to do their homework within nearly 150 Americans living, in fact, with 150 million Americans that are living now, have gotten the vaccine. Talk to someone you trust, like your physician or your pharmacist, or people who have already been vaccinated. Talk to your faith leaders or others in your community that you trust. Look to those people to help answer your questions. I want to be clear. I've been saying this a long time, but I really believe this is not a Democrat or a Republican issue. Science behind the vaccines has been under development for decades. 2 of our vaccines were authorized under prior administrations, Republican administrations. My administration, the Democratic administration, is doing the work to get hundreds of millions of shots in arms. While we may not always agree on everything, this is one thing people across the political spectrum can agree on. So I want to thank prominent conservatives like Mitch McConnell and a large group of Republican members of Congress who've medical training, who have advanced getting vaccinated. I also want to thank the 105 million Americans of every background who are fully protected from one of the deadliest pandemics.
We continue to monitor the remarks by the president on the status of the fight against COVID and kind of moving into a new phase, essentially trying to reach those people now who have not been anxious for whatever reason to get a vaccine. The president noting that the numbers have dropped some, though millions are still continuing to receive the vaccines, announcing a website, a text option, the idea to move the vaccine and distribution closer to people to make any difficulties they may encounter a little more pleasurable, or at least a little easier. Let's bring in Kristen Welker right now, our chief White House correspondent. Kristen, the president also down the stretch acknowledging this hesitancy, which is kind of a different issue, people that don't want to get it and trying to turn the corner.
That is really, Lester, the big issue right now, how to deal with vaccine hesitancy. At this point, about 40% of adults have been vaccinated. But if you look at the polls, it shows a large number of Americans are still concerned about potentially getting the vaccine. So there you heard President Biden saying, look, they are going to pour billions of dollars into addressing that issue, trying to not only give Americans confidence in vaccines, but to make it easier for them to access. So you no longer need an appointment at certain pharmacies, he said. And also he talked about getting these vaccines to those who are 12 to 15 years of age. Now, of course, that comes against the backdrop of the medical community expecting that in the coming weeks, Pfizer could give emergency use authorization for that vaccine. Now, that hasn't happened yet, and you heard the president very clearly there say that only the FDA will determine when and if that is appropriate. But Lester, based on my reporting, something else is happening behind the scenes as well. We know that top officials here at the White House have had conversations with governors today about the fact that if they do not want to use all of the vaccine doses that have been allocated to them, if the demand is not there, they can put the extra doses into a pool, essentially, and then those extra doses will go to other states that need them most. And so this is a real effort to try to get vaccinations to people in rural communities, people who might not have easy access to them. Of course, it comes against the fact that this is still a critical issue in this country with 50,000 cases per day. The administration vaccination making gains, but not yet turning the corner. And of course, the president setting that new benchmark for July 4th of having 160 million Americans fully vaccinated.
All right, Kristen Welker, thanks. Let me go to our chief medical correspondent, Dr. John Torres. And Dr. John, one of the things the president talked about was getting to the unvaccinated. You know, right now we have some of these super sites and other places that he says are maybe as close as the neighborhood school. But there seems to be a shift now in terms of getting these vaccines to where they are absolutely most needed.
And Lester, that's extremely important, especially moving forward with those that haven't gotten vaccinated or are hesitant to get vaccinated. And like you said, up until now, we've had these super centers giving vaccines. We have hospitals, pharmacies, but these are places where people had to go to get the vaccine. So people to the vaccine. And what they're shifting to now is getting the vaccine to the people. And what he talked about is getting it out to the rural communities, getting it to those community areas, getting it to places where people can get it. And it's convenient for them, because he mentioned that part of the reason people aren't getting it is it's too confusing and it's too difficult to get the vaccine. When you start moving it out to where the people are and getting the vaccine to their local areas, and you see other people getting it, people in your family, people in your community you trust, then you're more likely to get it as well. But one of the things the government recently has made a push towards is try to get that community involvement down there. And they actually have started a community core, they call it the COVID-19 Community Core, to get people involved. And anybody can get involved here to try and get their community levels up of vaccinations. You go to wecandothis.hhs.gov. That's the website they've talked to, on top of the ones they've been doing now for the other ones they talked today about the vaccines.gov. But this is where you can go and you can help promote vaccines in your own community. And this is an important step because, again, if you see people in your community getting it, and these are people you trust, you're more likely to get it. If it's outside work hours, you're more likely to get it. And if it's close to you, you're more likely to get it. And these are things that they're addressing right now and that President Biden addressed in his speech today.
All right, Dr. John Torres, thank you. We will have much more on all this tonight when I see you for NBC Nightly News. For now, I'm Lester Holt, NBC News in New York. Good day, everyone.